Hi, my name is Dr. Lewis Harper, and I'm here to talk to you for a few minutes about insomnia. You see, I've been practicing in northern Utah for the last 12 years, and I've been searching for a way to treat chronic patients. You know, the ones the other doctors have had no success with and have basically given up on and told them that they're going to have to live their life with that condition. Well, guess what? I finally found the answer. Now, it isn't just a pill, and it isn't just chiropractic care, and it isn't just supplementation. Insomnia is a tricky condition. You see, your insomnia can have a number of causes, and some of those causes are like consuming caffeine, eating a large meal, or exercising shortly before bed. They can all be easily rectified by making certain changes. What I'm talking about is insomnia that does not seem to have a known cause. Every day, thousands of patients who suffer from insomnia make the mistake of going to their family doctor because they don't have the information they're going to get here. Going to your family doctor and taking medications may result in your insomnia becoming more severe and worse. Yet, you may never get rid of the problem. The main problem with the treatments most doctors prescribe for insomnia is that they never go after the root of the problem, but they focus on the symptoms only. When the medications wear off, you'll often find they only cover up your problem for a short period of time and did nothing to fix what's causing the insomnia in the first place. Some doctors give their patients the newest medications on the market like Lunesta or Ambien CR, or Roserum. Some will use an antidepressant like Trazodone, or some will use an anti-seizure medication such as clozapram or Neurontin. Well, with Neurontin, I guess it doesn't matter that in 2004, Pfizer was fined $430 million for recommending this medication off-label. That's what it's called when they use it for something that it wasn't intended for. Now, as you know, all of these medications have side effects, and some are habit-forming. Insomnia is your body's way of telling you there's something wrong. If you're taking pills so you can sleep, and more pills so you can get through the day of work, then you're probably making the problem worse, because you've sabotaged your body's only means of keeping you healthy. Obviously, this form of treatment is not a permanent fix, because no matter how many pills you take, you're never going to get better. These pills can cause dangerous side effects like liver failure, kidney damage, and gastrointestinal hemorrhage. Trust me on this, these side effects are 100 times worse than the insomnia that you're taking the pills for in the first place. In my office, we leave no stone unturned to find out the cause of your insomnia. You see, we not only look at you chiropractically, but also look at you neurologically and for metabolic causes. Most people have been to chiropractors, so I won't discuss what we do here, but let's talk about looking at you neurologically and what can be done there. We first need to understand the nervous system and how it works. In the back of your brain, right up here, is an area called the cerebellum. Now, all information from your body has to go through that cerebellum. It takes the information, processes it, and then sends it to the brain itself. The brain then takes this information, processes it again, and sends the information to your lower brainstem. And once again, the lower brainstem processes the information it receives and sends it to the upper brainstem to keep it under control. Now, things can happen, and that flow of information is disrupted, causing the upper brainstem to go haywire. What causes the problem? Well, it's stress. It can be emotional stress, chemical stress, or physical stress. One of the causes of insomnia is when that upper brainstem gets out of hand, causing a release of certain neurotransmitters, which then causes insomnia. Now, the lack of sleep causes stress, and the cycle starts all over again. Once you get caught in that cycle, it's almost impossible to get out without proper care and treatment. Well, in our office, we use what's called brain-based therapy. We retrain your brain, and we get amazing results. If this is the cause of your insomnia, we can and will get you better. Now let's look at you metabolically. Is the cause of your insomnia a metabolic condition? Well, let's find out and get you better. When looking at you metabolically, we use blood work That might include lipid panels, complete metabolic panels, immune panels, CBC with differential or hormone panels. We may do stool samples, urinalysis, hair analysis, gut function studies, or food sensitivity studies. By getting the whole picture, we will find the cause of your insomnia. By using all of these tests, we can design a treatment protocol just for you. In my office, there's no cookie cutter approach like you'd find in a classical medical office. Not everyone is the same, so not everyone is going to get the same treatment. In our office, we utilize nutritional products, brain-based therapy, diet changes, and lifestyle changes to get you back to normal. And you know what? We get wonderful results. As you can see, we really leave no stone unturned to find the cause of your problem and then treat that cause. Because once we find the cause, we can find the cure. If you'd like more information, please contact my office and we'll send you an informative DVD and report for you to review. There's never an obligation to receive this information. Please call 801-416-8247 or you can leave a message at 888-772-0187 to request more information now. You can also go to my webpage at www.utahinsomniadoc.com. Ask yourself the following questions. How long have I had insomnia, and is my current treatment treating the cause or just the symptoms? How has this insomnia affected my family, my job, and my life? How has it affected my work and my productivity? What is it worth to you, and what would you do to get your life back? Please request more information now by calling 801-416-8247. Or, once again, leave a message at 888-772-0187. Or you can look up what we do in my office on my webpage at www.utahinsomniadoc.com. Let's get your life back and start you on the road to recovery. Once again, my name is Dr. Lewis Harper.